Aboriginal and Torres Strait Islander health workers belong to a unique profession and are critical if we are to close the health gap. They are highly trained and highly skilled and bring with them an understanding of culturally safe and effective healthcare. Wuchopperen Health Service is an Aboriginal and Torres Strait Islander community-controlled organisation in Cairns. It started 31 years ago and now employs over 180 people. Health workers in Wuchopperen are the first contact point for Aboriginal clients and perform a vital care coordination role.
Aboriginal and Torres Strait Islander health focuses on a family, an individual and a community in a holistic way. So it looks not just at being someone being ill or physically ill, it looks at their whole well-being, so their social and emotional, cultural, spiritual well-being and how that impacts on someone's health.
There you go. Thanks, mate.
Our client group is Aboriginal and Torres Strait Islander people. Community looks to come to our organisation expecting to see our mob providing them with a service.
I came to Wuchopperen Health Service because it's an Indigenous service and because I feel more comfortable coming here. Just like to see our doctor, please.
Our health workers, while they do have the clinical role because of their experience and their skills, they also are able to balance that with their knowledge from a cultural point of view around the community and around being Indigenous people themselves.
Prior to coming to Cairns, I was very much in a remote setting, northwest New South Wales in Walgett. The way that if you like, the infant steps towards the use of health workers was promulgated in the Northern Territory and then slowly in New South Wales and the seaboard states. It was sort of like an accessory, but I think that they've been moved from that accessory to the machine to an integral part of the machine over that time period that I've seen it. And I know that in my practice in Walgett, which was a private practice, we were, if you like, early adopters because we had such a large Indigenous clientele that we actually employed an Indigenous health worker, and that helped compliance, it helped transport, it helped communication, and I believe ultimately it helped health outcomes.
Any doctor in particular this morning?
Every client seen at Wuchopperen here in the medical clinic is seen initially by a health worker.
There you go.
And we call it screening, but it's much, much more than that.
Hi Noel, my name's Bruce, I'm one of the health workers here. What can we do for you today?
I was just asked to come in for some checks, some tests, blood tests and that to see if I'm diabetic or not.
Oh, no worries, we'll check your blood pressure and blood sugar and your weight.
There's the gathering of medical data, but there's also the gathering of information. Often that information is, shall we say, more subtle or more private or more culturally appropriate than would be perhaps understood by a non-Indigenous caregiver.
A bit up today. Just jump on the scales here.
All right.
Well, I got his story from him and why he came in and why he wanted to see the doctor, and I also discussed with him what else we can do for him, what other services we can offer.
So
it's a good idea to get checked.
Wuchopperen has always believed that the health workers are front and centre to healthcare. They tend to be the first person to speak to the client. They're also the first person that the clients will turn to if there's some confusion or they need further clarification and so on. And then in our model here, they're also the last person that they speak to because they're the people that are organising their follow-up and their transport and their recalls.
Do you have any family history of diabetes?
No, not to my knowledge. I've no idea.
There's a good chance you do. I mean, Indigenous people do have a high rate of diabetes and things like high blood pressure. Just having a look at your chart here, and I noticed that you have had a few high blood glucose readings over the last year. And I also noticed that you've been referred to the diabetes educator.
Oh, yeah?
Yep. So I might just give him a call and see if he's available to see you, and if he is, we'll take you down there, then we'll get you to see the doctor.
When we go down to see the diabetes educator, will you be coming down?
Yeah, no worries, that's not a problem. Yeah.
But you know, because I'm not sure what questions I should ask him.
No,
that's okay?
Yeah, that's fine.
Yeah, good. Yeah.
With Noel, he doesn't come in to see the doctor much, so we try to steer him onto managing his health a lot better. Tony is our diabetes educator. Thought we'd bring him down to have a chat with you.
So, Noel, what do you know about diabetes?
Not much at all, mate. Not much.
Yeah. Okay.
Yeah, I know it's no good for you, but...
Yeah, it's no good. Yeah. Well, Bruce would often accompany the client for the first visit. Bruce may come in for the second or third visit, but usually then we've built a relationship with the client, and the client feels quite comfortable seeing me on their own. What other risk factors do you have, you think, in your life?
Well, probably my weight.
Yep.
My age.
Yep.
I drink, I smoke.
Oh, yeah. So you're a smoker?
I've got a few, yeah.
Yep.
So Tony, how could Noel reduce his risk factors?
Yeah, well, there are a couple of things. We have a look at his diet and his activity level. See what sort of exercise or...
It's a bit hard, especially with the job I do.
Yeah, for sure. What you...
Sit behind on a desk now, mate.
Yeah,
A lot of sitting.
Yep.
Yeah.
Bruce's role as the Aboriginal health worker is really paramount because he brings an understanding of cultural safety and reflection into the whole consult.
You get clients who come in and they might go and see one of the allied health professionals by themselves, and next time you see that patient, they're going, "Oh, I didn't know what that bloke was talking about. How come he was sitting so close to me and, you know, he was invading my space," and things like that. And when you're there with an Aboriginal health worker, the health worker can help prevent those things from happening, to put both people at ease and make them comfortable, and to prevent any misunderstandings. And
Noel, you seem pretty open to some lifestyle changes.
Oh, yeah.
Yeah.
Depends how serious they are.
Yeah. So it's probably good to see the dietitian. And you said that you would like to stop smoking.
No, cut down.
Yeah, cut back. So it's probably good, and you're keen to talk to someone about that. And Bruce is probably the man to coordinate that with the dietitian and the non-smoking team.
yeah,
And
no worries.
Bruce?
I'll take Noel down to make some appointments to see the dietitian.
The Aboriginal health worker is really important in coordinating the services. So between myself and the optometrist and the podiatrist and the dietitian and back to the GP and any other services that the client may need, the health worker has a broad understanding of all those services.
Vicky, this is Noel. Noel needs to make appointments with the dietitian and the optometrist. If we could do that, please.
Oh, come in. How are you?
Morning. We work as a team here.
Have a seat.
I organised a meeting with Marion and Marlon because I did have some concerns in regards to Noel's social and emotional well-being. All right, that's all good. Thanks for coming in. He did state to me when he was leaving that he did have some issues. He's recently had a loss in his family and he's worried that he's started turning to alcohol to help deal with it.
When Bruce came and spoke to me in my office today, we brought another person from the social and emotional area in as well on the interview. Do you think that maybe some of your services over there can help him with his loss and his alcohol problem?
We can get him involved with the counselling and support and substance misuse programs and plenty of other programs around healthy relationships if he has any problems at home.
Give him a call and ask him about speaking to Marlon, that Marlon would speak with him, or
Yeah, I think give him a call.
How would you think that he'd go?
Because he's aware that I'm here talking to you guys about him.
We did a case study on a client that he saw, and the client needed some more referrals onto allied health people. Well, that was just basically a really, really good case of what happens here. You know, that's where the holistic approach and the cultural well-being and everything like that comes into place as well. You happy with that?
Yeah.
And I think it's very, very important here, because when the patients do come in here, they don't come in for one thing. Well, they think it's one thing that they come in for, but usually it's 3 or 4 different areas where they need to be referred to.
You tend to pick up on people's attitudes and their emotional state, and if you can do that, then you can go a long way towards helping them.
Just like a podiatrist or a doctor or a nurse, health workers are now required to be registered. The majority of our health workers at Wuchopperen have provider numbers, which means they're allowed to invoice Medicare for services delivered. To me, that gives you, if you like, a Commonwealth legitimacy to their role in healthcare. And I also think it's a pointer towards their increasing role in healthcare in years to come.
I've been doing this for 17 years now, and it's been good. It's been an interesting journey. All in all, it's been a good experience and made me a better person.